participating today? Yeah, okay. Thank you very much, sir, for joining us. From the Nigerian Union of Nursing Students Association, we have Emmanuel Babatunde. Thank you so much, sir, for joining us. I saved this one for the last because this is a friend who served as a past editor-in-chief of the Oshumsa Research and Journal Club, someone I know personally, and I'm so glad to see in the meeting. The representative from the Surgical Interest Group, Dr. Oya Omade Temitope. Thank you very much, sir, for joining us. Okay, I think one of the best things about this event is its cross-departmental and cross-sectional collaborations. We have people from different fields, different organizations joining us here today, and we're really glad to have you. Now we will be going to the fireside chat session with Dr. David Adetula from Public Health Interest Group Africa. Please, Dr. David, can I invite you to stand as I read your citation? Thank you very much. Dr. David Adetula is a dentist and public health researcher whose work focuses on the intersection of health systems, functionality, and health policy. With a background in both clinical practice and research, he is particularly interested in how evidence, community realities, and policy decisions interact to shape health outcomes across African health systems. He is the founder of Health Dialogue, a platform dedicated to fostering informed dialogue, advanced evidence-based research, and strengthening policy engagement around critical public health issues. Through Health Dialogue, David convenes diverse stakeholders, including health professionals, students, policymakers, and community actors to interrogate gaps within health systems and co-develop practical, context-responsive policy solutions. The platform also promotes knowledge exchange and collaborative initiatives to improve health literacy and encourage meaningful public participation in health governance. Beyond his work at Health Dialogue, David is a co-founder and executive director of the Public Health Interest Group Africa. He also serves as the chair of the Student Trainee Leadership Group of the American Committee on Clinical Tropical Medicine and Travelers' Health, a subgroup of the American Society of Tropical Medicine and Hygiene. Ladies and gentlemen, with a rousing ovation, let's please make welcome Dr. David Adetula. Welcome, sir. Dr. David would be engaged in a fireside chat, and to engage him on this chat on the topic policy making, writing effective policies as a student researcher, let's welcome our moderator for the evening, a member of the College Research and Innovation Hub, a member of the Surgical and Anesthesia Journal Club, Ms. Osisiogu Oyinyechi. A round of applause, please.
Good afternoon, everyone. I would like to welcome us all to the first panel session, where we'll be talking about writing effective policies as a student researcher. Dr. Adetula, it's a pleasure to have you here. Thank you so much for honoring our invitation.
It's me. Thank you so much.
So I have a couple of questions here, and we'll also be taking questions from the audience as well. So let me get right into it. For my first question, can you briefly tell us about how you got interested in public health policy and the first steps you took?
Hello. All right. Thank you very much once again for inviting me. Ayomide Oluwatimileyin. I mean, you guys are actually very amazing because it was a lot of constant reminders, you know, trying to get me here, and I'm very excited. And to be very honest, I'm sorry, I'll get to your question in a bit, but I'm just trying to lay a bit of foundation. I mean, walking here, I felt a little bit nostalgic because I remember the first edition, I was just seated right in the midst of the crowd, just like you. I mean, that was 2022 or thereabout. And I think Dr. Aigbonoga was the president or something then. And you know, coming around today, I'm so I don't even know the right word to use, but I'm excited to be here. All right. To your question, how did I get interested in health policy? All right. 2019, just when we're about to cross over to UCH, that was in UI. Then we were waiting for our second professional exam, MB2, the almighty MB2, right? And then everybody was scared and everything. And just before the results came out, I started to notice on my skin, right? I noticed some like patches here and there. I was so scared. And then I went to Jaja. So at Jaja, I met a doctor who gave some medications, right? But I noticed that these patches, instead of them to resolve, they kept like getting more. And it was very itchy and, what very erythematous and all of those things. So I used those medications for some days. I went back to tell him that, oh, look, this thing is not working and all of that. So I was given an injection second time. It wasn't helping. At that point, I had to call like some few lecturers, like who are like fathers and mothers to me. And they advised that I should come to UCH. I should request for a referral to UCH, which I did. At first, I was discouraged. Oh, don't worry, we'll manage it. You can't do this. All right. So to cut the long story short, I came to UCH. To start with, the process to actually get registered here was a little bit cumbersome, despite the fact that I am like about to be a clinical student of same institution. And I remember that when I was done with that registration, before I got an appointment, I was given an appointment for about a week or so before I could see a dermatologist. In my head, I was just thinking about the fact that what if what I was battling with then was a life-threatening situation? Do you understand? In my mind, I'm like, oh, then there's a problem. Why should I have, why do I need to wait for up to a week to see a dermatologist? At that point, I started to ask different questions. I started to think about what could be wrong. Trust me, that was actually what got me interested in public health. And since then, it's been public health all the way.
That's wonderful. I'm very curious as to the first steps you took. So you got the interest in public health. What did you then do to get into policy writing?
All right, thank you very much. So, so afterwards, I had a friend whom I actually discussed with, and if that's going to serve as a lesson to anyone here, being in the right community is always very good. People would stimulate you. People would not just, you share things with them, they laugh about it and you move to the next. No. People would want to help you, deepen your curiosity. And that was just it. And at that point, I told that friend, and we started to ask that are there communities of, public health experts? Especially even right in school. Then there were a lot of people doing antimicrobial stuff and all of those things. But public health wanted a space where we could nurture those desires, to build that desire, but there was none. So that was how she told me that she's from Unilag anyways. She's not a doctor anyway. So that was how she said, why don't we start something? And that was actually what birthed Figure. That's Public Health Interest Group Africa. And then we started to learn, we started to take courses, started to, attend conferences, and that was how I actually got interested. And those were the first set of steps that I took.
I know you're also the founder of Healthier Log. So you've told us about how you founded Figure. What led to the creation of Healthier Log?
All right. Thank you very much for your question. I did my housemanship at the University of Nigeria Teaching Hospital, Itukwazala. That's in Enugu State. So, and then when I was there, anyways, while I was there, I got into an internship program. I became a clinical intern for the clinical group of the American Society of Tropical Medicine and Hygiene. I think the current clinical group in 10 is even in this school at the time. So, I mean, now. So, there, I got exposed to tropical medicine, infectious diseases, and all of those things. And as a result of my interaction with some of the things that were happening in the infectious diseases world, I started to interrogate a lot of things. And luckily enough, that was when, it was just about the time when the US president altered or, reduced funding towards HIV/AIDS prevention and care and all of those. So that was how I got curious about, okay, look, this is a policy problem. Like, why do we have to depend so largely such that if the United States pull funding for such a critical intervention, then the whole structure would collapse? That was actually what got me interested. And I felt like for us to make decisions, for us to make any headway, we need to go to the grassroots and even interact and understand the burden of those who are actually most affected, those who are actually living with these conditions, right? Get to know them and all of that. Honestly, that was how FIRESIDE started. And we just had to convene a dialogue, like I like to put. And luckily enough, also as a virtue of, by the virtue of my interaction with ASTMH, we got some little grants for, to take off. And that grant, we deployed it into organizing that engagement forum. And I mean, that was it. FIRESIDE started.
Thank you very much. So I want to ask about the actual process of writing a policy paper. So what are the key differences between writing a research paper and then converting that into a policy document?
All right, thank you very much. I think when I received the invitation to come around, one of the things I had in mind, or I intended to actually tell everyone who is participating here, is that you must leave here understanding actually the difference between research, publications, and policy. As beautiful, amazing, and lovely churning out papers can be, it takes more than writing papers, having publications to make an impact. And of course, unfortunately, because it sort of adds to the portfolio in a way, and of course, we understand what writing publications means. It builds you in a way, and of course, it makes you more valuable, especially for those who would like to, go for graduate programs, all of those things. So, but the truth is, we have a lot of people who would write papers, who would publish papers, but will not be making the desired impact that actually, in the first place, led them to writing that paper. How do I mean? So, basically, a publication would add to the body of knowledge, right? And you realize by the time you are done writing your paper, or at the later segment, or the last parts of your paper, of your publications, would include perhaps conclusion and maybe limitations and a few recommendations. But a policy actually would start from where research ended. Because what policy would mean is that you interrogate those evidence and pieces of evidence that you already have from your study, and you start to apply them into what is currently existing. And maybe it's a good time to also probably take us through the stages involved in policy formulation. All right, so the policy process is it's not as cumbersome as you may think, because the goal would be that we're living here today as student researchers and begin to say, oh, look, I can't just stop at making, writing papers alone. My papers must translate to desired outcome. And again, just a little dive away from the discussion, you would ask yourself, like, why is it that we have a lot of people in the or in the academic, they are doing a lot of research, but those research are not translating to the action we desire? This is just the difference. Policy would mean that first, okay, I'll start by saying the first stage in policy process would be setting the agenda, knowing exactly what the problem is. And again, as simple as that sounds, it's not straightforward, because some people would just look, there's a problem with access to healthcare. I mean, the question is, what exactly is the problem with access to healthcare? So you must be able to interrogate further and understand what exactly is limiting access to healthcare. And after you have, identified what the problem is, the next thing would be to understand what evidence, like what pieces of evidence exists concerning that topic. What papers, and that is where your papers come in. Your papers are no waste. They are crucial. They are in fact fundamental to writing policies. So once you understand what the problem is, right, try to get pieces of evidence everywhere to substantiate what the problem is. In fact, it could mean in some instances that you will have to go into the communities or where exactly those problems exist to survey those who are there to understand the nitty-gritty of the problems, right? And of course, when you identify what the issues are, then it is always good. I think I would dwell more on this further, but it is always good when you identify a problem that you carry along the stakeholders involved. One of the problems also would be some people, they know there's a problem, they delve into trying to provide a solution for that problem, but they are not, interacting with stakeholders in that particular field. And I'll quickly mention that one of the advantages of interacting with those stakeholders would be to understand what they have been doing. Now, I'll give a very practical instance. I remember when we were in school, when I was here, I think I was in my clinical phase of my program, when the the College of Medicine here brought up some, policies around mental health and intended to help, students go through difficult moments and all of that. And when it got to a point, some students started to say, oh, look, these are not speaking the solutions they desire. These are just paperworks, right? They are not fixing the problems for them. Then at that point, I started to think that what could actually be the problem? And of course, when we talk about developing a mental health policy for students, it would mean that you must robustly engage students. At this point, I'm sorry, I'm not even saying that maybe it's just student leaders alone. Student leaders can go back to meet their colleagues, convene forum, right? And try to understand what the problems are. You understand what the issues are, so that would actually inform an evidence-based policy. So I'm saying, in essence, that you can't develop any policy without actually carrying along stakeholders. And when I mean stakeholders, I mean those who are affected or those who will be affected by the policy you're making. I mean those who are going to implement those policies. I mean those who are going to, basically bring that policy to life. So, and of course, I mentioned earlier, first thing is try to understand the problems, on that setting the agenda, right? Understanding the problems, gather evidence, right? Engage with stakeholders, right? Then the next thing will now be to formulate those policies you intend to do. Now, you already know there's a problem with access. There's a problem. What exactly are you recommending to fix this problem? And again, people make a lot of mistakes here. People would say things like, I'm giving instances so it helps us to understand profoundly what I'm trying to say. Some people would say, I'm trying to solve a problem. I'm solving the problem of access to healthcare, right? And that would be the recommendation. No, that's actually very bogus. I mean, it says nothing in essence. But of course, when you are formulating your policy, you are very specific. It could be that, oh, for instance, let's say Jaja. I know many of you will be able to relate with this. When you were in UI, for instance, you probably have gone to Jaja and you waited for a long time before you could see a doctor. And some of you be like, that Jaja is rubbish. That Jaja is nonsense. All sort of things. But again, if they ask you, even as a student researcher, what should be the solution or what recommendation are you bringing forward? You probably will say, let's improve access to healthcare in Jaja. But that's not it. So I'm saying when you're giving your recommendations in your policy, you are interrogating the issue. It could be a very right, accurate recommendation would be that, oh, I'm recommending that usually we have about, let's say, a doctor in Jaja attending to maybe about 200 patients, students within a number of hours, right? Can we increase the number of doctors coming to attend to, to patients, or can we create multiple service points? I mean, when I mean service point, I mean points where doctors get to see, students. That would ensure that the waiting time to see a doctor is, reduced. And that way, you are recommending an effective policy. All right. So when you formulate that policy, again, I don't want to lose you. I'm saying agenda setting, which involves what? Involves you identifying the problem, right? Also, the second point will be to interrogate what is already existing in literature. What is literature saying about this problem, and gathering evidence. And it could also mean that you go a little bit further to ask to survey those who are involved. And the next thing would be to carry the stakeholders involved along, right? And also you would then move to formulate the policy. And the next thing would be, after you have formulated the policy, again, ensure that at every stage of this policy process, you are involving stakeholders and those who are going to implement it. So the next thing will be the adoption. And usually at this stage, depending on the kind of policy you are getting at, you may not be the biggest decision maker in that process. Now, for instance, policy is just something that ensures a set of principles that bring changes, right? So even at the level of IUMSA or UADS or whatever association you belong to, you could bring up policy, and maybe those who would bring it to effect could be the executive council or probably the legislative body. So at that stage, maybe you're able to influence. But let's say, for instance, when we're talking about this mental health thing, like that is done by the College of Medicine, at this stage, probably you are developing a policy that you would like to give to the College of Medicine. So you know that those who are going to adopt such policy are those who are, in the college. So those are those that will adopt. So that stage belongs to them. And after that policy has been adopted, the next stage will be what? To implement the policy already. And of course, at this stage, many people also get it wrong when you're implementing policy, because people think it's as easy as, we have our policy brief, a 2-pager or 1 page, then that's it. That's not it. It's not as easy as that, because what the content of your policy is and those you are trying to reach would determine the method of implementing. And lastly, you're not just implementing your policies and going to bed. No. The last but very critical in the loop is policy monitoring and evaluation. Again, ask yourself, there are a lot of policies here and there, but why are they not effective? Because, sometimes nobody is monitoring the progress. Nobody is evaluating how effective they are, because when you evaluate and you identify gaps, then, like they will say, the policy process is a cyclic process. You go back to that start and restart the process. All right, thank you.
Thank you very much for that comprehensive guide to writing policy. I have a final question for you, and then we'll be taking questions from the audience. How do we as students, seeing as we're quite a bit distant from the lawmaking apparatus in the country, what can we do to, okay, we've written the policy brief, how do we now get it to where it can be seen by the stakeholders, especially on the national level?
All right, thank you very much. So I want to correct a notion to start with. As students, you are not far away from impact. I understand what you're trying to say. So, but of course, I just needed to mention that you're not actually far away from making desired impact at any point where you would love them to be. Because the truth is that whatever global or national goal you seek to achieve starts locally. All right? It starts what? Locally. And, you know, in fact, for students, you have an edge when it comes to ensuring that whatever policy you are bringing forward scales compared to, you know, the policymakers, like, I mean, extant and professional policymakers now, because you are even closer to those who are affected. For instance, if you seek, again, I like to talk about a lot about access to healthcare, because like I mentioned earlier, that was actually what actually drove me to public health. I mean, that was what got my interest, right? And for instance, you as medical students, you have that opportunity to interact with patients every day, right? You go for your clinic rounds, you meet patients, you hear from patients firsthand, but it is very unlikely that someone who is a policymaker, perhaps in Abuja, maybe the director of health policy in the Federal Ministry of Health in Abuja, would have that enough interaction with patients who are affected by the problems you are trying to solve than you. So now come to think of it, who has better access? Now you have better access, and you can start to, you know, use whatever platform you've got to push your agenda, in quotes, right? So, and of course, perhaps you want to say that, oh, maybe there are a lot of stuff out there, they are not making the point. But truth is that achieving an impact with your policy is no beans. It's something that you must be very, very staunch about. And that is why it is very important to also note, you don't go about trying to formulate a policy for something you are not actually passionate about. Because that passion is what will keep you going. I mean, just on the final note, I just wanted to share this example. I remember there was, I was attending a meeting where we're planning for a webinar, and then there's this woman who was trying to talk about a particular condition. She's from UNTH. I don't want to mention name. And she was saying that for the longest time, she has been trying to get, you know, the government to see the problems and the solution she's trying to provide for a particular condition. And she says she's been there, she's been doing that and that, but she's not giving up. I'm saying that don't expect that at your first push, you would have a breakthrough, especially when it comes to policy. So again, you need to be resilient, and you are not distant as you think from achieving an impact through your policy that you're recommending. Thank you.
Thank you very much. We are not distant from generating impact. So now we'll be taking questions from the audience. If you have a question, kindly step forward. We'll also be taking questions online as well. So if there are any questions, you could just type it out so we could see.
All right. So, good afternoon, Doctor. Thank you very much for the enlightening session, but it was very, very enlightening. I hate to play devil's advocate, but I have one question.
Sorry, your name, please.
Okay.
Introduce yourself. Thank you.
I'm so sorry. My name is Timtopo Oyaromade. I didn't put the doctor yet because I'm still waiting for my induction, but you get the gist. All right. All right, thank you very much. Well, yeah, my name is Dr. Oyaramadete Mtokwe. Thank you very much. All right, so concerning what you said about policymaking and how it intersects with research and all that, it's kind of brings a very familiar thing in my heart, and I would like to ask your opinion concerning one major challenge I've observed with writing a research, developing a policy through it, and implementing that policy. The truth is that no matter how good and nice a policy we bring out, especially in healthcare, it looks or sound, especially to the general public, there will always be individuals or organizations that it will be counterintuitive to their own personal interest in one way or the other, financially, culturally, or in any way. And most of the time, this category of people or organizations that always serve as bottlenecks to this policy. And you made mention when you were rounding up, because I had a question on my mind about the doctor that kept trying with the government, and she's still trying to make a headway. So my question is this: that, sir, with all of this now, should we say there's any point in pushing forward, especially when we know that trying with our own efforts is not really yielding much efforts, especially with structures like the government or individuals or organizations that it is counterintuitive to their own personal objectives? And what will you say would be the best suggestive approach for us to do this? Do we have to put ourselves in the government and implement our own policies, or how can we get them to work with us and carry out our own policies? Thank you very much.
Good evening, everyone. Thank you so much, sir, for the insightful session. My name is Ishaq Sanusi. I'm a medical student of UI. So the question is Ishaq Sanusi. So the question I have is majorly kind of practical, but I will ask the question first before I bring about the practicalities. So what do you think are the major problems that are actually affecting policy implementation? And I'm actually asking that because of what I've been seeing lately. You know, currently in East Africa, like Congo, Uganda, they are currently experiencing a global pandemic. Like, it's rising daily. The numbers are increasing. And there's something that I've been seeing on Instagram, I think on WHO's website, that USAID that was cut across Africa is really affecting that particular problem. I even saw one funny thing of recent that some of the things that the suits that the protective gadgets and suits that they wear, the healthcare workers wear, like they started complaining that it's not enough because there's not much funding to source that, which is so absurd. Just up to just a protective care, and it's affecting how the condition is rising a lot there. So now I'm now bringing the question back to the African, like, grassroots. Why is it that we have to be so much dependent on them that when we experience just a sudden, just that kind of pandemic, is affecting us greatly? Like, what particular part of policy implementation can really address that? Because it's something that people don't really talk about, and is a kind of Pan-African issue. So it's going to it's kind of international. So what bodies and what practical implementations can actually like influence that? So that's what I'm going. Thank you.
Hello. Thank you very much for your questions. I mean, these are very, very lovely questions. And of course, it shows that we have curious minds. And then I'll start with Dr. Temitope. Thank you so much for that question again. You asked that there are a lot of people who are like, they are seemingly counterproductive to policy-making efforts, right? And you're asking what approach can we navigate to ensure that we break that, that cycle, right? So I like to say, and I think every one of us should note this. For those who have interest in public health and especially policy, there is no permanent enemy or friend in the process of policy making. I'll be very practical. During the COVID-19 pandemic, we had people who were anti-vaxxers, right? And in fact, we may even have some of them amongst us here. Because I know in ABH then, we had some guys who were actually against taking vaccines, right? They were very loud about it. And I mean, and we have most of us who were actually very, were promoting people to take vaccines and all of those things. And with time, because of the engagement, I didn't have time to actually delve so much on this, because engagement is the bedrock of policy formulation. Not everyone would understand what you are trying to do from the get-go, because they are not seeing what you are seeing. Now, tell me, someone who knows, or someone who probably was in a community where, because we wanted to get what's his name now? This guy that was killed, Osama bin Laden. We introduced a vaccination program in that community so that you could have access to understand what is going on in that terrain. And you expect that the next time people from the West coming to Pakistan in that community, same community, and you are telling them you are bringing a vaccination program, how do you expect them to embrace such program? Because trust, was broken in that process. So I'm saying that people have genuine reasons why they don't take some of these vaccines. Apart from ignorance, it could be due to what they perceive. In fact, it could be cultural barriers and everything. So I'm saying that most of those barriers that you see against you pushing for a breakthrough regarding One Health policy is sponsored. The barrier is sponsored by certain knowledge, certain thing. And of course, engagement cannot be overemphasized. You need to keep engaging and engaging. Any organization who is not agreeing with you, or anybody is not agreeing with you today regarding a policy, may agree with you in a month's time, as long as you keep pushing. And that's just the bedrock of policy formulation. At the point, at the point when the COVID-19 vaccine there was a policy that everyone traveling should take the vaccine. And most people decided to take the vaccine and everything. Some people were still hesitant. Vaccine hesitancy was large, especially in some African countries, was a lot. But with time, that figure reduced. It went down because of constant engagement, providing substantial evidence to prove that truly what you are trying to push forward would be helpful, or would be very, very good for what you are trying to achieve. So, yeah, time. All right. So again, engagement. You can't get tired of engagement. Now, I'll follow on the second question now from Mr. Issa. Thank you so much for that question. I can't seem to see him in the crowd. Okay, great. Awesome. Thank you. So yeah, you're asking what problem exists in policy making. You will have a lot of people who are like those Dr. Temtope described, those who will be against you. And of course, I know if we have graduate students here, perhaps those who are doing MPH, or people who have immersed themselves in policy making, you would realize, or public health generally, you must have been told that public health is not a space that perhaps just your brilliance would make you have some headway, or would make you a successful public health professional. Technical knowledge is not sufficient. You need to build engagement, network with stakeholders, interact with stakeholders, engage them. In fact, lobbying in some instances, constant engagements. And that is why some people will say casually, say, your success in public health depends on those you know. Those who are making those decisions. So I'm saying this to say that one of the biggest problems is people not seeing what you are saying, and you need a lot of engagement to achieve that. Now, you raised a question. I think when I walked in, I heard Dr. Stephen, Stephen, right? From the guy from DTH lab. He was saying something that talking about this same problem you raised. That's about funding. Health financing in Africa is a big problem. And of course, we know your guess is as good as mine. Our priorities are always wrong. Usually wrong in Africa and in the country. Because, much of our problems are as a result of the lack of political will, right? Because there's the advocacy that, channel about 15% of your annual budget to healthcare funding. But still, year after year, we realize that at the end of the day, the budgetary allocation to healthcare is hovering around 5%, 6%. And at the end of the day, even, there's the difference between budgetary allocation and what eventually comes in for you to do what you need to do. At the end of the day, when you look at the funding that actually came in, you realize that maybe a total of, let's say, 3% or even lower than that would come in. So tell me how you want to achieve what you want to achieve. So the reason also is because corruption. Corruption. You realize some people are profiting from the inequity that exists in our society. So not until those things are actually addressed, we keep having that problem. Now, in those countries where they say there's no PEP, for a long time, African countries have relied too heavily on dollars coming from the US, pounds coming from the UK, and all of those stuff. And that is why at a point in time, we can curse, we can talk bad about Donald Trump for all we like, but the truth is this guy did us some little bit of service. He made us start thinking about the fact that what if those dollars are not rolling in? What can we do locally? And you realize when that's the funding, state funding was cut, it got to a point that many countries started to be very intentional to pull out funds to intervene in AIDS program. And you will see things like, Nigeria starts to say that now the reliance on USAID or the funding coming from the US has been halved, or it's really low. So not until we start having this mentality that whatever is coming, we're so dependent on AIDS, like that is how we thrive, and start dealing with the corruptions that exist and start channeling those money into something very reasonable and productive, I think we might just still be hovering around the problems. So again, we're all involved in that advocacy process. We need to advocate and even right from our own little corners, do the right thing. Thank you.
Thank you very much for honoring our invitation. Thank you very much for giving us the practical steps to policy writing and also the importance of being resilient and engaging stakeholders at every point. Thank you so much for your time. We've come to the end of this panel session. Thank you all for your attention thus far.
So much for your time. So I wish you a very great conference. Yeah, thank you so much. Yeah.
Please, another round of applause for Dr. David Adetula. He has taken us on policy making, writing effective policies as a student researcher. We're moving on now to our workshop, writing a successful grant application for undergraduate researchers. And our speaker is Greta Holmes. So before Greta Holmes comes on stage,